Good evening, everyone. I'm Dr. Shivani Joshi, and I'm going to be presenting the poster titled Looking Beyond the Pediatric Cataract. So we had a child, 2-year-old male, whose parents noticed a leukocoria in the left eye since the past 6 months. He did not have any significant family history or any past history of any significant past history. He actually had come to our center because he was diagnosed with a PFV with cataract outside and was advised surgery, but due to financial constraint, he had come to our center. We did an ultrasound B scan and we did find a stalk-like structure extending from the optic disc to the lens. But in another view, we also found the entire vitreous cavity filled with vitreous hemorrhage, as well as the small multifocal structures with internal high spikes suggestive of calcifications along with retinal thickening. So we conducted a contrast enhanced MRI to further enhance our diagnosis because we had a doubt on suspicion of malignancy in this case. It did show a stalk-like structure just posterior to the lens extending posteriorly, which was T1 hyperintense and D2 hypointense. But on the posterior wall of the globe, there were also multifocal lesions, which were T1 hyperintense and T2 hypointense. Along with that, in T1 image, we also saw the vitreous cavity entirely slightly iso to hyperintense, suggestive of vitreous hemorrhage. These are some other sections showing the same along with contrast enhancement. So we did an examination under anesthesia and we did find that there was ciliary right eye was completely within normal limits. The left eye had ciliary congestion, neovascularization of the iris, a yellowish glow, and a just posterior to the lens capsule, we could see a vitreous hemorrhage. IOP was 34 millimeters of mercury. So we made a differential diagnosis of retinoblastoma, possibly a diffuse infiltrating type, a Coats disease with a total retinal detachment and NVG. Resolving endogenous ophthalmitis could also have been there because of the yellowish glow and RD, persistent fetal vasculature, as well as a medulla epithelioma. We had a plan of action of further asking the parents that there's a high suspicion of malignancy. They finally consented to undergo left eye enucleation with a PMMA implant under general anesthesia. On histopathology, we found that there was a retinal thickening along with the retinoblastoma malignant cells, although the optic nerve sclera and the choroid were free of tumor. On high power magnification, we found these small round blue cells, but it was poorly differentiated as there were no florets or rosettes. Pathological staging of P1, PT1, N0, M0 was made. So can it be both? Yes, PFV has been described along with retinoblastoma in one case scenario published in 1977, and a second case with retinoblastoma in one eye and PFV in the other eye. Now, the child right now has a scleral cell prosthesis and is maintaining a good vision in the other eye with no retinoblastoma. Sibling screening was done and found to be negative. Could we have done it better? Could it have been avoided initially? A color Doppler imaging could have given us an idea whether there was stalk, had a patent hyaloid artery, as well as a contrast enhanced ultrasound has been shown to have a rapid inflow and a rapid washout in cases of malignancy such as retinoblastoma and malignant melanoma. So learning points are that in all cases of pediatric cataract which we suspect, we should have a thorough investigation, examination under anesthesia and CE-MRI for suspicious cases, and enucleation can be considered in cases of diagnostic dilemma like in ours. Sibling screening is of much importance in these cases.